Good evening, friends. Welcome to this weekly edition of Miraculous Mondays, episode number 16. I'm your host and host, Dr. Bhavdeep Singh Ahuja, presenting to you these lives for the first half of this year. And I really hope that you have been liking this series. Friends, today is Miraculous Monday, also known as Management Mondays. Today, I'll be discussing one of the short topics of practice management, one of those of you who are in my WhatsApp group, they know what we were discussing. Dr. Rajat shared a wonderful case scenario from his part. So, coincidentally, my presentation of today was based on a similar topic. So, I'll be sharing a portion of that topic. I hope you find the topic really relevant for you in daily routine practice. So, just allow me to share my screen and let's begin the proceedings. Okay. So I hope my screen is visible. Just checking it online. Yep, it is. Okay. So friends, welcome once again officially to episode number 16 of the 26th episode that we have planned for the first half of this year. Today is Monday, 18th April, and I'm live before you at our designated time of 8:15, 8:20 p.m. So let's begin today's session without much ado. As I detailed, today's topic coincided with one of the wonderful case scenarios shared by Dr. Rajat Anand in the WhatsApp group, in my WhatsApp community, wherever you are. So most of you are in my WhatsApp community. Those of you who are not, kindly let me know. I'll add you after the session is over. So just a second. Yep. Yeah, that's okay. That's okay now. Okay. So as usual, all my presentation always would begin with thanking the Lord Almighty has given me much, much more than what I deserve. So this is my brief CV. You all are aware of it by now. So won't be wasting much time over it. But yes, a little bit of authority according to me by this CV, so that I can share a few things with you that I know a little bit about. So today's topic is about 10 helpful tips on sharing feedback. We all are very fond of, you can say, taking feedback from our patients. We all want it. uh, you all know one of the last slides always in my presentation is please give me a feedback. Focus and big bags both would be welcome in equal measure. So I'll be sharing a few tips, namely 10 only. Of course, the list can be endless and the topic can very vast. I can spend a full day on just on the feedback topic itself. Without even the boring part, I can spend that. But yes, let's limit ourselves to what we are discussing today. So we all look out for feedback, चाहे peers हो, associates, staff, employees. If we are working in a workspace or job space as an employee, so from our employers, so we all want to have that good working environment, build on good relationships with our peers, our staff, and our life in general. We always want to believe that अगर life सुकून से चलती रहे, सब कुछ ठीक चलता रहे, तो everything looks, you can say, rosy and happy on the outside. And of course, when we are happy from inside, the same reflects on our attitude outside as well. So we always should strive to look out for feedback. Even if we are not taking it, look out for other. Because I believe that feedback is one of the sure, short ways to assess yourself, if not grow. People believe, yes, even till some time back, I also believe that feedback is the process to grow. But I would say, yes, it may be, in hindsight, it may be, but it is properly for me, you can say, the process to introspect, to really know where we are. Because sometimes we are blinded like that blinkers on the horse's face when it is running on a tonga, and it is blinded by what is happening on the side. So only when people get out of ahead of us, then only we realize that, oh, it was so clear, it was so far, it was so close to us. And that is why we should look out for a feedback in our workplace, improving our SOPs, our standard operating procedures, protocols, systems, work culture, and our way of working. We cannot be perfect. We have to accept that. And when you are not perfect, you should always strive to improve. The one thing that you should do daily is be better than what you were yesterday. So that is the best thing. If you keep that in mind, you'll never ever falter. Never ever falter in life. Because you have to grow each day. Maybe in microns, maybe in millimeters. But yes, do be better than what you were yesterday. And the only way is most of the times the feedback. Because we all strive to be a better individual. Things change, systems change, and we have to get adapted to it. So we should look at the same, or the feedback, I would say, as a direction changing process, which will help us to improve our services. Of course, we can give better quality care. A patient comes in and just gives you a feedback. Doctor साहब मैं 10 साल से आ रहा हूँ, ये मशीन तब भी यहीं होती थी, आज भी यहीं है, बड़ी साफ सुथरी रखी है. टंग इन चीक इट माइट बी कि 10 साल से भाई साहब आपने वही मशीन रखी हुई है, चेंज नहीं करते, अपग्रेड नहीं करते. That is sometimes a tongue in cheek humor, and we just sometimes take it with a pinch of salt. Yes, this is my very, very well oiled machine. This has given me so much work. Fine. You are not charging what you were charging 10 years back. So why using the same machine? Just a very small example. And sometimes the patients, when they are free, even after being injected, you keep on talking. You'll keep on observing your clinic scenario. ये मैं 10 साल पहले 5 साल पहले आता था, ये फोटो यहीं लगी थी, ये कॉर्नर में यही था, वो कॉर्नर में मिट्टी पहले भी होती थी, अब भी होती है. Small little things. These will be patients' observations. I'm not saying that every clinic is like that. I'm just giving you a very, very small example. Some patients are very observant, especially female patients. Male patients might not be that much. But then, आपके पास क्या है? Your record keeping will tell you whether you are more of female patients or more of male patients. You have to look out for that record. I know my percentage. I know what percentage of patients I have as my male patients and female patients, how many geriatric, how many pediatric, how many middle age, how many. I have that, all those things. Now I've stopped doing it since past 2-3 years, but before COVID, I had everything for the past 19-20 years of my practice. Now I'm in 23rd year of my practice. So I had those data for a lot of time. It gave me a lot of insight into certain things. Then some of us have a habit of collection of information. डेटा इकट्ठा कर लो, माल इकट्ठा कर लो, लेकिन उसको यूज नहीं कर, उस इंफॉर्मेशन को यूज नहीं कर. आई कॉल दैट एज अ नॉलेज कोलेस्ट्रॉल. Of course, borrowed from someone, you can say one of my mentors only, but I call that knowledge cholesterol, when you are collecting information and not using it to improve yourself, because sometimes the mindset is closed. You don't have an open mindset. You may be doing things in a particular way which are suiting you, which are suiting your workspace, which are suiting your systems, but they may not be the best way. We need to realize with time we need to change things. जो आप 10 साल 15 साल पहले कर रहे थे does not mean that holds good even in today's times. Trust me guys, 2 days back I was in Expo in Delhi. For the first time in you can say 2.25 years, सवा 2 साल में, I was out of Punjab for the first time. All my workshops have now been online. I've taken all offline lectures, but in Punjab only thrice in this 2-year plus period, ever since the first lockdown. But I went to Delhi even for the first time just 2 days back. And trust me, what is my one-line feedback? The paradigm shift is happening in industry. LGNet has almost disappeared from the market. It might come to as a shocker, but yes. Putties have diminished. Yes, they are still available. I'm not saying they're not available, but LGNet was available in loads and loads and loads. It's almost disappearing. The more focus is on digital dentistry. As I could see, I could sense that in the, you can say, the experiment part. Then eroters, normal eroters, Chinese or Korean or whatever, they're getting extinct from the market. The push button, the wrench type eroters are getting extinct. The push button is replacing it big time in the market. More emphasis is on certain things. Everything is coming from Russia. Anyways, that is a different matter altogether. But then this is the way. You need to be prepared for certain things in life. Certain things will not be available after a certain period of time. What will you do? You have to change. You have to change your way of working. So feedback matters in all spheres of life, but more so in professional sphere. where the competition now is breakneck. It is really a lot. So I'm going to give you 10 helpful tips on sharing feedback today. Of course, feedback can have multiple avenues. If I talk of the word feedback, it can be an idea, it can be a response, it can be an opinion, a survey, a comment, a rating, a result, and an advice. All these 8-9 types are types of feedback. We just look at one aspect, rating. And the flip side of this, compliment. Because we are habitual to listen to bouquets. Nobody is ready to take a brick bat. Sometimes that comes loaded with a pinch of salt or even chili sometimes in the form of advice. डॉक्टर साहब मेरी एडवाइस मानो, आप ये पर्दे अब चेंज कर लो, इन्होंने काफी साथ दे दिया आपका. The patient is trying to say, भाई साहब फट चुके हैं पर्दे, गल चुके हैं, सड़ चुके हैं, घस चुके हैं, whatever, बदल दो अब तो यार. But he chose a better diction to say that. So an idea, response, opinion, survey, comment, compliment, of course, rating, result, advice, all are forms of feedback. So let's see. So we can observe a lot of things in our own practice. We can talk to patients. Patients will informally tell you a lot of things. अगर सिर्फ वो फीडबैक लेके फॉर्म लेके पेशेंट के सिर पे खड़े होना है, sometimes you will not get the right answer. You go to a restaurant, पसंद आया नहीं आया, ओके टाइप लगा, बुरा लगा हो तो yes you will definitely do it. अगर ओके टाइप है, वो वेटर आपके सिर के ऊपर खड़ा है ऐसे लेके पेन और वो, and you are like चल यार भर दे फटाफट, बेटा तू भर दे, excellent 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 डाल दे, keep up the good work, thanks, बस नीचे नंबर डाल दिया, एनिवर्सरी पे कॉल आ जाएगा, 20% ऑफ है, आ जाइए डिनर कर लीजिए. This is where sometimes feedback is given. If you are doing the same thing in a restaurant, why do you expect the patient to do the same in a formal manner? Sometimes, I'm not saying patient will not do it, but some of them will not really do it or really give you that opinion, an honest opinion. An honest opinion might sometimes come out of informal talks. डॉक्टर साहब जो आप बात करके तरीके से समझा के इंजेक्शन लगाते हो ना, I love it. मेरे को इतनी टेंशन थी ना, मेरा कल से बीपी बढ़ा हुआ था, आपने इतने प्यार से इंजेक्शन लगाया, मेरा तो आधा डर निकल गया. आधा नहीं भाई साहब, 80% निकल गया. The patient is being discounted in that regard. But this is a good feedback for you. अब ये चीज शायद आपके पेपर पे नहीं आएगी. Maybe it can come, but usually नहीं आएगी. But this gives you going in the right direction. Flip side of this, imagine the scenario. डॉक्टर साहब इंजेक्शन में बहुत दर्द हुआ, इतना तो मुझे अपनी डिलीवरी के टाइम पे नहीं हुआ दर्द. Seriously, people say these things. I got to hear this thing last week from one of my patients. I use a very, very thin needle, very thin. I inject very slowly. I can vouch for it. Even kids don't feel the pain. I can vouch for it. Kids actually compliment me, uncle, bilkul dard nahi hua. Yes, I am uncle for them right now. I'm no longer the young boy. I'm the middle-aged man now. So, but yes, if any patient, female patient especially says, डॉक्टर साहब इतना दर्द क्या, मेरे को मेरी डिलीवरी के वक्त भी इतना पेन है, you know it is a false feedback. But sometimes patients will say it. That's okay. Take it with a pinch of salt. Absorb it. Don't feel hurt by it. Don't feel, you can say, feel that you should react to it. This way. Then there might be a payment feedback. डॉक्टर साहब पेमेंट आपकी बड़ी बन जाती है ना, कई बार आप ना मशीन लगा लो, आप ले लो. फॉर दोज पीपल स्पेशली हु हैव अ कैश ओनली अप्रोच, बिकॉज वही है, इनकम टैक्स में कहां से दिखाएं सारी. Small little things patients will keep on saying informally, which will not find their way in the actual feedback. The problem is sometimes we get so bogged down in the daily ongoing proceedings of the clinic that we ignore these small little things. That is where we miss the bus. We look out for the testimonials and the written feedbacks, and वो formal तरीके करने में time spend करते हैं. Informal में कोई नहीं करता. How many of us actually love to spend the time with the patient? Very few. I do. I really do. I really love talking to them. I'm an extremely introvert person. I rarely open up. Even in my family, I'm known as one of the quietest persons. But I don't even stay quiet for a minute in my clinic. Of course, I don't talk useless things. I talk only sensible things to the patient to just soothe them, to lessen their anxiety. But patients after 5 years will forget how much you charged. They will only remember how they were treated. ऐसे भी and वैसे भी. ऐसे भी means treatment wise, वैसे भी means behavior wise. There are a lot many factors. We keep on thinking, यार काम इतना अच्छा किया था, patient didn't come back, patient ने दोबारा कुछ भी नहीं करवाया, इतना कुछ और करने वाला था, उसको अवेयर भी किया था, the patient never came back. Why? The patient felt यार डॉक्टर ने काम तो कर दिया, बताया कुछ है नहीं, किया कुछ है नहीं, पैसे मांगे दे दिया, बात खत्म. You are not much vocal. We did not share. कुछ बोलोगे, बात करने से ही बात बनती है, कुछ बोलोगे तो कुछ सुनोगे. Might not be always pleasant. For this fear, sometimes people don't speak only. जैसे अपने काम से काम मतलब रखो. Drill, fill, and bill. That is the approach with them. To an extent, with some patients, it's fine, but not with all. Feedback is all about learning, building, and measuring. This is a process which goes on continually, and we need to realize. So let's come to a few smart tips, come to the topic, come to the business for today. 10 feedback tips, 10 helpful tips. Number 1, never belittle or devalue your patient's suggestions, opinions, grievances, and complaints. Sometimes complaints may be coated with a pinch of salt, coated with a flavor, coming as suggestions, coming as opinions. You might want to, you can say, reject it after a thought, but don't outrightly, openly reject it. That is one big advice I would like to give. Number 2, always give your best to your patient. And don't go on pestering your patient, asking, how was I? Was I better than your previous dentist? I know I was. Did you ask or did you tell? Did you wait even wait for the reaction between your 3 sentences? No. So always let the patient decide if he chose you over his or her previous dentist. Was that experience worth it? Was that risk worth it? It is a risk for the patient. He had a dentist, he was not much happy. He came to you on a referral. You turned out to be even worse. But you are singing your own tunes. Was I better? Yes, I was. Surely, I hope so. So many of our patients say it. So how I hope you are in our fan club right now. Ask the patient. Don't make the judgments yourself. And that brings me to the third tip. We have 2 ears and 1 mouth for a reason. And we always need to remember it. When you're doing the consultation, you can talk as much as you want. Once you're in the business of working means you're with your mask and everything and on, talk to the patient. Work on the patient. Don't talk in between then. Because at that moment, some of the patient may be having an anxiety, some may be having a fear. They will feel ये डॉक्टर बोलता जा रहा है, पता नहीं इसका ध्यान है भी है कि नहीं काम में. I vividly remember a pre-COVID scenario. I was at my friend's clinic. एक हैबिट होती है ना, काम करते करते कई बार मास्क नीचे कर लेते हैं हम लोग, कई बारी छोटा सा थोड़ी देर के लिए रोटर चलाना. Sometimes we do it. I'm talking about the pre-COVID scenario. कर लेते हैं. I was sitting in his, you can say, office only, across his, you can say, working area, and the patient, he was talking while with his mask down, and the patient raised his hand and said, Doctor Saab, अब काम के टाइम पे बोलो मत प्लीज. I was there. I was listening. Said, okay, I won't. He finished the job after 10-15 minutes. The patient before leaving said one thing. I still remember that to my friend. He said, डॉक्टर साहब एक एडवाइस थी, काम के टाइम पे जब आप बोल रहे थे तो आपका छींटा मेरे यहाँ पे पड़ा. स्मॉल थिंग, फोकस के अलावा ये चीज भी हो जाती है कई बार. वेरी स्मॉल थिंग बट इट मेक्स अ डिफरेंस. So we have 2 ears and one mouth for a reason, and we always need to remember it. So talk only half as much as we listen is the golden proportion. And then don't just seem to pass away or spend the time while the other person is talking. If you have asked for an opinion, suggestion, or feedback, actively listen. Listening is unspoken caring. William Osler said it. If you're not a good listener, you are not going to get a good feedback from the patient. And if the patient is giving you an opinion and you are looking at your mobile, looking at your assistant, making gestures, not paying attention, the other person will feel pissed off. You say, why am I giving the opinion to a person who is not even interested in listening to it? Forget it. That brings me to the fifth point. Like a tennis match, sometimes you may have people of two equal caliber or players of two equal caliber. हर वक्त आप एक प्लेयर एस नहीं डालेगा ना, कई बार रैली भी चलेगी और कई बार बहुत लंबी रैली चलेगी. It's not always about to deliver an ace that yes, I'm the master, I delivered the best. The patient should be bamboozled now. The patient should be in awe of me now. The patient should be a big fan of me now. Let's keep the ball rolling, as they say. So keep the ball in play, keep the conversation on. Sometimes people don't want to hurt someone by saying a direct thing. They'll try to say a few things in a quoted manner. They want to give a sandwich feedback. We have to realize that. Ken Blanchard said, feedback is the breakfast of champions. And if you're not taking a feedback, you are missing your breakfast. And we all know breakfast is one of the most important meals of the day. So number 6, always listen and pay full attention to the patient. As I said, listening is unspoken caring. स्कूल में होते थे तो टीचर क्या बोलती थी? Can't you hear me? Physically present, mentally absent. Almost all of us have heard this phrase in our school time, if you remember. That means we have to not concentrate partially but fully by whatever person is saying, verbally, physically, and emotionally, by being totally immersed, by paraphrasing, by repeating the last one or two words, by summarizing, you mean this. If you are initiating a conversation, finish it. If not, if you're interested in मैं बोलूंगा, patient बोले ना बोले, अपने को कोई फर्क नहीं है, stop it. Then number 7, get rid of the personal bias, filters, assumptions, judgments, and beliefs, because they will always color what we hear and the way we hear. ये तो खड़ूस पेशेंट है, इसने तो उल्टा ही बोलना है, इससे तो हमने कुछ पूछना ही नहीं. पूछ लो, शायद ओपिनियन अच्छी मिल जाए, एडवाइस मिल जाए. Just because we don't want to hear any negativity, I stay away from negativity. I just came back from Himalayas, so I just want to hear positivity. This patient is extremely negative. We have formed our own opinions, our beliefs about certain patients. Get rid of that. Then the last 3 points are in terms of questions. In any conversation, if you have to take a good feedback, you should always know one thing: asking the right questions. If you can ask the right questions, you can arrive at the solution very easily. But then that information should not only be for data collection or assessment. It should be for assessment also, for rollover also, for understanding that and bringing about a change by taking an action. It makes the patient also feel valued. So always ask good questions. If you know your art, if you know your trade, you will ask good questions because they'll help you understand better and give you more productivity, more positivity, and more creativity by patient's opinions only. There is not a dearth of ideas around us. And effective questions can help us connect with our patients in a more meaningful way. Feedback is all about going forward, going backward. How am I going? It is just a reflection. Then where to next? Future. Then where am I going? Goal setting. It is all a part of that. So never ignore this. Then cross-examine more effectively. Again, this is not a part of feedback, but then asking the right questions can be setting you in the patient's eyes as a good doctor. He can give you good feedback in bargain if you have asked the right questions for the diagnosis and the treatment planning part. As always I say, ठंडा पानी पीने से रिलीफ मिलता है, वो पता है आपको क्या पोजीशन है, क्या सिचुएशन है, कौन सी अनोमली है. Let the patient speak up. People will not pay you for information. There is loads and loads of information available on Google. People will pay for you for the results. If you can give them solutions, they will pay you handsomely. So do the problem solving in a solution oriented manner. Then ask leading questions. Would you like to talk about it? What do you think can be done in this regard to improve? If somebody has given you a negative feedback, negative opinion, or whatever, doctor, I did not like this. Take it on your chin. Take it on your chin is an Australian language. They say it in Australian language. That take it on your chin means you accept it gleefully, happily. What do you think can be done in this regard to improve? Or a different way is to ask open-ended questions for which there has to be an answer. The how, the what, the where, the who, and the which. Avoid the word why. I'll come to that. Because open-ended will never lead to a one-word answer. They'll provide the length and the breadth and tend to start with where, what, how, when, who, or which. Avoid using the word why question very, very sparingly, or use it very sparingly, or avoid it totally. Because why is usually associated with being sounding critical. If you're giving a feedback, you don't have to start that with criticism. आपको अच्छा नहीं लगा ट्रीटमेंट, मुझे अच्छा नहीं लगा ट्रीटमेंट. Why? What aspect you did not like, sir? How can we serve you better? Where were the areas where were the areas you found something deficient? Which are the gray areas present in our way of working? Please detail us. Just a why will mean that the patient has to give all the explanation. But when you use these 5 words, these will make the patient understand that probably the doctor is more open-minded and willing to listen. So we started from here. I would say for the carry home gyan, avoid leading questions in the beginning itself. Because otherwise the communication will go in an undesired direction. For example, kindly suggest if you feel so that we can try to treat you in a better way. First, get to the problem. Which were the gray areas? Please tell us. If you just kindly suggest us, this is a good question, but can be more concentrated to the approach. Avoid questions which allow only yes or no, because then they'll be limiting in your scope. कुछ तो लोग कहेंगे, लोगों का काम है कहना, people will have sometimes no problem with the clinic but they will find the dentist wardrobe. डॉक्टर साहब ये कौन से रंग का आपने स्क्रब पहना है, बहुत गंदा सा कलर है, इसको इसको मत पहनना आप। स्वामी डॉक्टर साहब चेयर्स बहुत पुराने हो गए, अब आप चेंज कर लो। आपके सामने पार्किंग ही नहीं मिलती है। ट्रीटमेंट डज नॉट कम इन ऑल दिस। You have to take the feedback. You don't have to feel offended in any of the comments or opinions by the patient on these subsidiary topics which are other than treatment. Laugh it off, or maybe try to, you can say, yeah, yes, we'll surely do something about it, like that. You can start your feedback with leading questions always and then switch to open-ended ones. If you ask open-ended questions, patients will find it more value. Then the patient can easily expand that and explain the answer why he gave that opinion. So try, understand and read the patient's mind first. This is the reason I always say try to get into the other person's shoes first. There is nothing right or wrong in this world. It is just the perspective that matters. Sometimes you really have to be in the other person's shoes to understand why he did so, what was his situation demanding that, and why did he end up doing that. He may have his own reasons. You are sitting on the other side of the fence, you might not be able to tell the correct reason why he did it. So understand and read the mind. I hope you get the carry home gyan of today's session. And I hope I have set your think buds in a, can say, a position where you can concentrate a bit more, reflect on the situations in your clinic which have happened in the past 2, 3, 4 days, maybe which position you could have handled that better. And if not, then my favorite slide, Japnam, Japnam. Sorry for wasting your time if that was there. So friends, this is one of the workshops that started today with the pre-workshop homework. So actual workshop starts next Monday, but normally as usual, I close the registration 5 days before because I want my audience to be transported into that zone of, you can say, the workshop where they are watching the videos first and doing the homework along with, and the actual workshop starts next Monday. For 3 weeks, total workshop is 4 weeks. So I do it once every 6 months. These are 2 separate workshops. I've combined it on public demand. So there are, you can say, the details are on your screen. There are a lot of sessions. The sessions have increased now. Of course, I detailed out the final schedule today only. So this is the logistics of this. So you can pause the screen and watch the details later, but the registration closes tomorrow for this workshop. So thank you so much for watching it. And this is my WhatsApp group where the topic was shared by Dr. Rajat today. So if you want to be added, please send me a message. I'll add you in my WhatsApp groups. Group number 6 is on, and I plan to limit them till 6 only. So this is my YouTube channel. If you are not yet a subscriber, do hit the bell icon, do subscribe and then hit the bell icon. I keep on posting a video every alternate day. As on 10th April, 450 plus videos are already there on the channel. So please send me your feedback, valuable feedback. This session was all about feedback. On my cell, on my phone, on my WhatsApp group, on my page, wherever you're watching it, bookers and brickbats both would be welcome equally. Thank you so much once again, and I stop my share for questions and acknowledging the visitors on my FB page where it is happening. Okay. Hi, Dr. Rajat. Yes, Rajat, I mentioned you at the start. Your case scenario was wonderful, and you handled it actually, you can say, in a perfect manner. Hello, Dr. Ramchandra sir. Hello, Dr. Rajinder. Hello, Dr. Parul. Hello, Dr. Vinita ma'am. Hello, Dr. Sandeep. Hello, Dr. Akansha Bale. Good evening, Dr. Sandeep. Thanks a lot, Dr. Ramchandra. Hello, Dr. Kriti. So if there are any questions, please do let me know. I'm here for 2 minutes. I can answer them on today's topic. If there are not, we'll call it a day. And I see you on Thursday for the Thunder Thursdays episode number 16. This series is fast culminating towards its end. We end on 30th June with 26 episodes. Right now we finished 16th episode today. So the end is not far. So let's see it. Hi, Dr. Gaurav. So, okay, friends, this is it for today. I hope your start to Monday or your start to the week was good by a blissful Monday, and you didn't have any Monday blues. So, do take good care of yourselves, and I see you on Thursday in Thunder Thursday. Bye bye. Take care. Have a great week ahead.